The Yate West Gate Centre is all about bringing the highest possible quality of healthcare closer to where people live. There's a large range of services available here at the Yate Centre, and it's a really good example of how we've brought together the expertise from acute hospitals with local facilities so that people can reach those services much more easily. We have, for example, got outpatient clinics in breast care and in respiratory and in many other specialties, which mean that people don't have to travel to hospitals for their follow-up. Another really important facility here is the availability of X-ray, which together with the minor injuries unit means that people don't have to travel into emergency departments at acute hospitals, and again is a really good way of bringing together what general practice needs with what can be provided from acute hospitals.
What makes the Yate West Gate Centre special for me primarily is the fact that it's slap bang in the middle of the community area where people live, where they shop, where they come every day. The services that we've developed in Yate are the first of 3 to come online. The other 2 integrated or co-located services will be based in Kingswood behind the Civic Centre and in Severnvale in Patchway.
The specific services that we do offer cover mainly minor injuries. So for instance, simple sprains, lacerations. We have the facilities to X-ray and to suture and to apply plaster casts, all which are very useful. We have a specialist slit lamp for examining eye injuries as well, given that we have quite a lot of light industry around here. The other half of what we do is that we are able to refer very specifically to services that we aren't personally able to offer. So for instance, there is an emergency care practitioner service for keeping the elderly out of hospital locally. So we can make specific informed referrals to those people directly to cut out the middleman, make the patient experience much smoother.
Other things that we have are the Sure Start Centre downstairs, the Children's Centre, and on the top floor, what we call the Hub, which is an environment where different groups of people work together, actually an awful lot of different professionals. We've got there the area social care team, working on child protection and family support. We've got school nurses, we've got health visitors. We also have a range of educational professionals, educational psychologists, educational welfare officers. We have the area manager for the youth service. We have connections service there and the personal advisors, again working from that space.
The CAT service stands for Clinical Assessment and Treatment Service. It's separated into 2 parts of the service. There's a peripheral service and also the spinal assessment service. It's an orthopaedic musculoskeletal triage assessment where we see patients with a wide range of conditions, both traumatic and degenerative. Our service receives about 2,500 referrals a year. Within that figure, we manage 50% of those patients conservatively. By conservative management, it can consist of physiotherapy, podiatry, or education and advice given to the patients. It's a very cost-effective service. We see people in a very timely manner. We have great patient satisfaction, which we have lots of audits to actually follow that up and back that up.
This is a really exciting time for the way we provide healthcare for the people of South Gloucestershire and for Bristol more widely. A huge investment is being made into buildings and facilities, but they've been designed around what patients need and what's really going to make a difference for the way that they come to healthcare and the way that they get that care in the most quality setting that they can. There's both the Yate Centre here, which will provide expert care very close to where people live, and that feeds into the broader plans around acute hospitals, which means that when you do need to go to an acute hospital, you get the best possible facilities as well. So I think that this is really fantastic news for the people of this area.
Hello, my name's Sean Bolton. I'm a member of South Gloucestershire Links, and I'm involved in the PCT working with Cossham Hospital friends say Project Broad and also the Patient Experience Committee, and I'm shortly to be involved in the project for Thornbury. My experience of working with these projects has been that there has been a full and active engagement to sense of a working relationship with the link. As a disabled person myself, I've been very heavily involved in the work of the Improving Patient Experience Committee, and I've been able to feed that into the NHS workload on how they consult with members of the public, what aspects of engagement they want to have, how to make that engagement more personal, more meaningful, and also so that it's not tokenistic.
My name is Graham Kennedy. I am chair of the Safe Cossham Hospital Group, which has now changed its name to the Cossham Hospital Group. Yes, well, when this community hospital reopens when the work is finished in October 2011 and full service is back to normal by April 2012, we will have our extra things on site here, like an MRI scanner, a CT scanner, a birthing centre which will be on the top floor, and down the back in the old stables as it was, we will have a renal dialysis unit. And the amount of services which will come in here are more than were here before. It's all part of the Bristol Health Services plan, bringing services into the community, which will be a good thing. And the other thing about it is at the present time we're talking in terms of around 70,000 people being treated here, or 70,000 appointments, whatever you want to call it. This will, we believe, probably more than double to plus 150,000 plus per year. NHS, as far as I am concerned, have moved a long way from where we were in 2004. Talking to the people, listening to the people and involving the people has worked. It hasn't been a case of 50% lay people and 50% establishment getting in there and having an argument. That hasn't happened. It has worked, and an exchange of views have been quite honest, open, and it's worked. And that's as I said, any consultation in the future without this full involvement cannot be classed as a proper consultation.
I'm very hopeful that NHS South Gloucestershire will continue to do the massive amount of engagement that it's been doing with these projects, one of them behind me. I think it's important that if whether it's clinicians and professionals who have an important role to play in these commissioner projects, engage with the people who use services. The public will ultimately be the service recipients. Yes, the different people might be commissioning, but at the end of the day, it's important to ensure that those services are working, linking together, and they're all on the same field. And NHS South Gloucestershire, I believe, is leading the way in that direction. I'm hopeful that it will continue, and I think that the residents of South Gloucestershire should feel very pleased that there is engagement with the community.